Welcome to the webinar. Say hello in the chat when you hop on. We're getting YouTube live here to make sure that this is recorded for you so you can go back and watch because we're probably going to drop some truth bombs and you're going to want to go back and re-listen. So I will also share the link for this so that you can get to our YouTube channel really easily so that you can subscribe and be notified anytime that we upload a new webinar. So I will do that now. I just want to remind you that Dr. Saunders is a wonderful doctor, but he is not your doctor. So we just ask that you consult with your healthcare provider before you implement any of the things that we talk about on the webinar today, okay? All right. I'm going to share that YouTube link right here. If you're on YouTube, hello and welcome. You are free to ask any questions there as well. We'll do our best to answer those while we're live here. And you know what? If you are watching on Zoom, if you can post your questions as we go into the Q&A, that would be very helpful. So look at all of these people hopping on, saying hello. Judy, David, Susan, Sib is back.
Joe's back.
Joe's back. Belinda's
Yeah,
here.
there you go.
Oh, Kathy's here. Jacob. Awesome. We're so glad that you guys are here. Welcome back. Welcome if it's your first time. Let us know that in the chat as well. It's going to be an important topic today. We're actually going to be talking about how sleep affects our health, specifically our blood sugar and our heart health. So this will be a really good topic. I'm a little tired today. There may be some others on who are tired today.
Me too.
So,
Hey, my
but
friend Alex Rose is on. He's
yay.
one of my patients.
Oh, hey, great. All right. All right. Okay, I think we're ready to rock. Let's do this. Let's talk about sleep. Take it away, Dr. Saunders. Where do you want to start?
Okay, sleep. Okay, so we focusing on sleep and saying how it affects blood sugar and heart disease. It's a big topic and it's really important. So if you were to take like all of the things that we think are really important, like our diet and supplements that we take and drugs and surgeries, all that stuff, the big portion of healthcare and wellness and all that stuff, and you were to put it into a category of how it affects your health, um, that part would be like, I don't know, 20% of your health. What's the other 80%? Well, the other 80% has more to do with your adrenal glands than anything else. And sleep is a big part of that. So your adrenal glands, cortisol being the primary hormone there, regulates your sleep-wake cycles called the circadian rhythm. Everybody has a circadian rhythm. Everybody sleeps. All those people that tell you, I never sleep, I haven't slept in 5 years, when they actually take those people and do sleep studies on them, they actually do sleep. So, this is just like a little curiosity here. It's kind of funny that the people who say they don't sleep have about the same sleep as people who say they sleep like a rock. So why are they so, their perceptions are so different? Well, here's the weird part. Everybody wakes up between 5 and 10 times a night, sometimes more, but everybody wakes up. And so you have these wakeful times. And do you know how, like, are you ever like awake at night and your partner says something really funny in their sleep and you're like, oh, I gotta tell them that in the morning. And then you go back to sleep and you totally forget. You go, oh, you said something really funny and I cannot remember what it was. Some people, when they wake up, they remember being awake. And then other people, they wake up and they don't remember they were awake. So if you're one of those that remember when you were awake, you'll say you're up at midnight, you're up at 2, you're up at 3, you're up at 4, you're up at 5, you're up at 6, and you're going, I was awake all night long. I didn't sleep a bit. I didn't sleep a wink, because you don't remember being asleep, but you do remember being awake multiple times throughout the night. And you look at the clock each time, you go, yeah, I'm looking at the clock all night. It's just like a terrible night. I didn't sleep at all. And the same person with the exact same pattern of sleep wakes up the exact same number of times, doesn't remember it, and says, I slept like a rock all night. It was great. That's the difference between people who say they sleep really well and people who say they don't. Now, there actually are people who don't sleep well, and that's a different issue altogether. And that needs to be addressed, because if you're not sleeping well, then your circadian rhythm is not going to work. And if your circadian rhythm doesn't work, then there's certain things that don't happen. So, what happens while you're sleeping? Repair. It's called the anabolic metabolism. So, you have two different metabolisms, only two. You have the catabolic metabolism, which is when you're breaking down your body. And why would you break down your body? Well, because you're using it, and you're doing stuff, and you're eating, and you're making energy, and you're creating oxygen free radicals, and I already said eating, right? And breaking down the food and all that other stuff. And so while you're doing that stuff, you're breaking down your body. It's no different than a car. If you're driving a car, you are breaking down your car. I don't care how careful you are driving a car. Okay, I'm just going to go really slow. It doesn't matter. Your engine's getting hot. Your engine's wearing out. Your oil's getting yucky. Your tires are wearing out. Everything about your car is going downhill if you're driving it, right? So you have to, do tune-ups periodically, change the oil, rotate the tires, get new tires, so that you can periodically update your car so that it doesn't like completely break down on the side of the road and be done with it, right? Your body is just the same. You get to repair all the damage that's done. And everybody thinks, well, that's automatic, right? This happens like all day, all night. No, there is a specific time set aside by this in the circadian rhythm by your body to say, this is my repair time. And if you're not in your circadian rhythm properly, then you miss the repair time. So, like, how many times can you miss an oil change before your engine seizes up and doesn't work anymore? There's only you can okay, it says 5,000 miles. I go 10,000 miles. I put synthetic oil in, and so what if I go 12,000? Is that going to be a problem? No big deal. But what if I go 100,000? Well, yeah, that's going to be a big problem. So the same kind of thing with your body. When you are exercising, you're wearing out your joints, you're wearing out your tendons, you're wearing out your bones. Everything is getting worn out. Your muscles are tearing. You're literally tearing muscle fibers when you're working out and lifting stuff and all of that. When you build muscle, how do you build muscle? Well, you do more than you can. You push a higher weight than you can. And then what you're doing is tearing muscle fibers. And then when they repair, the body goes, oh, I better fix that better than it was, because I don't want that to tear again. So you actually make it stronger when you repair it. Bones, the same thing. How do we get osteoporosis? Well, because we're sitting around doing nothing. You have to go out and pound the pavement, literally pound the pavement, break bones. Do I mean like fractures? Well, yeah, as you're walking down the street or running or whatever, you're making little teeny micro fractures in your bones. That just the little trabeculae are going, little crunching your, and then on a cellular level, when you become anabolic, the repair mechanisms come in and go, oh, we got to fix that. We better make it stronger so it doesn't break again. And then, so that's how the bones are remodeling all the time. So muscles, bones, your brain has this pressure wash system that is just amazing. It only happens at night when you're asleep. So this is only known for the last 5 years. They had to change all the medical textbooks, all the anatomy books that said there's no lymph system in the brain. So they put a whole new name on it. It's called the glymphatic system. It's called kind of like glamping, but totally different. This glymph system in the brain, it isn't there. It's like you can't see us until you go to sleep at night, and all of the cells, the support cells in the brain, not the neurons themselves, the support cells, they shrink down, they leave space between them, and then the cerebral spinal fluid comes in and pressure washes everything out. gets rid of the tau proteins, the neurofibrillary tangles, all the stuff that causes Alzheimer's disease gets cleaned out, cleaned out, cleaned out, cleaned only when you're sleeping. If you're awake a lot, too much, if you're not sleeping, you don't clean out that part. And then what happens? Well, then you get Alzheimer's disease and you get brain fog and you say, my brain doesn't work and I must be getting old. I'm losing my memory. Why did I walk into this room? The open door syndrome. All of those things happen. So, from head to toe, all of this is being done while you're sleeping. And if you're not sleeping, it's not being done. Well, how does that affect your blood sugar? When you're not sleeping, you have a release of cortisol. Cortisol makes you resistant to insulin. So you can get, just from not sleeping, you can get insulin resistance. And that makes your blood sugar go up, makes you make more insulin. Insulin tells your body, don't use fat for energy, so your energy goes down. Store all your fat, so your fat goes up. So you gain weight, less energy, and things don't repair, fix, and all that. So your blood sugar just gets worse and worse and worse if you're not sleeping. Sleep is a very important part of repairing this diabetes stuff. So in the diabetes solution kit, we don't just say diet, although we talk about it all the time, like it's important. Yes, it's important. But we start out with the whole thing. If you've done our book, if you don't have the book, you better get it, because you have to go through the first steps of what is your why, how are you going to fix this, what else do you need to do, where's your stresses. You have to go through all of that, and if you look in the book on cardiovascular disease, we spend this much on diet and this much on stress. Why? If you're not sleeping, you're stressed. And if you're stressed, then you can't repair. Oh, this is so cool. Okay, let me tell you how it works. You have your blood vessel. So let's say we're looking end on in a blood vessel right here. And the blood's flowing through there and everything's going really well. And you have this lining in it called the glycocalyx. And the glycocalyx is like a super smooth gel fur that has no resistance to blood. So you have this thick blood going through these little teeny blood vessels, and it just flows totally because the glycocalyx offers zero resistance. So blood's flowing through there, and then something scrapes the glycocalyx, and it opens up, and it exposes the cells underneath. And that exposure of cells causes a clot to form. And so then the clot is going to get more clot and more clot and more clot. And within seconds, APCs they're called, and they're a type of stem cell that they pave over it really quickly. So you have a clot, and then all of a sudden, these pavers come and pave over it. And they become their stem cells, right? And they immediately become endothelial cells, which is the lining of the blood vessel, and they start making a glycocalyx. So now you have the cell with this little clot, and then the pavers paved over it, and it's just like a brand new blood vessel. Is just like, so it's kind of like if you were to, like, on a freeway. So you're going on a freeway. There's like 5 lanes on this freeway, and there's an accident in the left lane, and so everybody kind of has to slow down, and it clogs things up. But what if within seconds of that accident happening, some tow truck came by and pulled it right off the road, and then everything traffic kept going, and it didn't get clogged up? That's the way your blood vessels work. Like, it's so fast. If you have high cortisol, if you're not sleeping, it doesn't happen. So what happens? You get atherosclerosis. That's how it happens. Is you don't dissolve the clots, you don't get the APCs. The APCs don't work if you're not sleeping. So this is like really, really important for cardiovascular disease. And it's the cause of cardiovascular disease.
Wow.
So the stress part, right? So your cortisol is high. Why? If you're not sleeping, you have high cortisol, and it's the cortisol that blocks those APCs from covering over that clog in your that clot in your artery. So sleep is so important. So how do you sleep? What if you're one of those that remembers waking up frequently? Here's what you do. And this is a trick that works. So, and we learned this from something called Zolpidem, Ambien. Um, Zolpidem does not, it's used as a sleeping pill, but it does not help you sleep. All it does is make you unconscious, unaware, so you don't remember waking up 10 times at night. And that's all. It's just a non-memory. So, for example, I had a patient that I actually, shame on me, gave him some Zolpidem. I don't do this anymore. And he was calling the cops like every night, every morning. He's calling the cops and saying someone was in my house last night. Somebody moved the tools around in my garage. There was stuff out in my kitchen, and so he's like, I'm the only one that lives here. Nobody else could have done it. So he's calling. The cops are coming over to his house like every day. So one day he wakes up lying on the kitchen floor with all the sandwich stuff spread out on the counter. And he's like, oh my gosh, it was me the whole time. He was getting up, walking around, sleepwalking. And the reason he couldn't remember it and he's calling the cops is because of Zolpidem. It just gets rid of your memory. So you can't remember being awake. So it doesn't help people to sleep. All it does is gets rid of their memory. So how do you do that? You know what? You don't have to do that. That's the whole point. You just go, I don't need to take a sleeping pill. I don't need this Ambien. You just lay there for a little while. Everybody's awake for anywhere from a minute to a few minutes to even 20 minutes isn't abnormal. So if you're laying there for 20 minutes, that's perfectly okay. And if you remember waking up 5 times a night, that's perfectly okay. So what I generally do when people have those issues, I tell them to get a sleep monitor watch or the Aura ring or something um, to um, to allow them to actually monitor to see what their actual sleep is. I know they're not perfectly accurate, but it'll give you an idea of your general sleep every night, and it'll tell you how many times you woke up, and you'll go, oh yeah, I remember that one, I remember that one, I remember that one, I remember that. It's okay to wake up and remember being awake 5 to 10 times a night. That's perfectly okay. So you just lay there and then you'll go back to sleep and you won't remember going back to sleep because you're asleep. You don't remember it. And so, but you'll remember being awake. And so you'll think you're awake all night and then you'll look at your monitor and you'll go, oh, I actually got, 48 minutes of deep sleep and an hour and 20 minutes of REM sleep. My restorative sleep is great. So it'll just give you a chance to see what your sleep is and how it's okay to be awake. So the people that I know, the doctors that I know that are sleep specialists, and I've read several books on it, they don't recommend sleeping pills. And they just tell you it's okay to be awake and lay there for a little while. If you're laying there for hours, then you may have to do some what they call sleep hygiene, like exercise more during the day so that you have to sweat enough to use up the energy in your muscles. That's something. Or you may have to go to a neurologist and figure out if you have something like Parkinson's, something like a degenerative neurological problem that is affecting your sleep. So there's a lot of different possibilities, but if it's just, I woke up 5 times last night or I was awake all this time or whatever, try just laying there and letting it be and then not getting stressed about it, because when you get stressed about it that it affects your blood sugar and your heart disease.
Oh, this is good. Okay, feel free to ask your questions in the Q&A. Well, I know Joe had asked how many hours of sleep, did you guys get last night? I just double checked. I'm tired today, but I got 7 hours, which I knew. I looked right away, which isn't bad for me. I will typically get 7 to 8 hours. But my kids started school today, and I think there was just some mind stress in there a little bit too. So,
They're starting school already?
yeah,
I
so
got 7 hours and 13 minutes. Huh,
I wonder what mine was exactly. Oh, I lied. 6 hours and 53.
that's not bad.
63. No,
So
not terrible.
7 to 9 hours is the optimum.
Yeah, it's okay. I am tired today though, I can tell. So gotta figure that out. But I see that uh Althea got 9 hours of sleep. Belinda averages between 6 and 7. Joe said tips for falling asleep fast. I focus on relaxing my eyes. Seem to be very effective, and that's usually the last thing I remember when I wake up. And it works. All right. Belinda said last night, 4 hours, 17 minutes. Not good.
Not good.
How are you
Yeah, that can be.
feeling?
Not good.
Yeah.
I also,
When I
oh,
wear the Whoop, I can really look at the details of my sleep, but like it's interesting. Like it gives me a sleep score. So last night I slept 8 hours and 51 minutes, which is crazy long for me. I'm usually 7:15, 7:20. But my sleep performance score, according to Whoop, was 85%. And the biggest reason why was because sleep consistency,
yeah.
which you're like ideally you're going to bed and waking up at the same time every day. And that is very random for me. I mean, within a couple hours, I'm usually in bed between 10 and midnight, but even just dialing that in within 10 or 15 minutes, like has a big effect. So even though I slept like 9 hours almost or whatever, I would have been better had I gone to bed at the same time as the last couple nights or something.
Yeah, yeah, they do these studies in time zones. So if you skip one time zone, so if you're 1 hour different in your sleep, it doesn't make a lot of difference and you can catch up pretty easily. But if you go two time zones, it makes a difference. So having those 2 hours of difference in your sleep schedule really changes how your sleep works.
Yeah. I got to bounce off to another call, but carry on, my friends. Good to see y'all.
See
See
ya.
you, Joe.
I'm going to actually go take a nap. Just kidding.
Okay, another nap after 9 hours of sleep.
Right.
Allison said I sleep well for 4 to 6 hours and then I'm awake. Any suggestions? Might I have sleep apnea? I do not snore. Thank you.
Okay, so that's an example of how that how sleep works. So you're asleep for about 4 hours, and people go to sleep, and this is a very common thing. They go to sleep, and then the first stages of sleep in those first hours between 10 p.m. and 2 a.m. is deep sleep, called slow wave sleep or deep sleep. And that is the restful sleep, and that's where you're cleaning out the it's called adenosine in your brain that causes you to be sleepy. And so when people at night they go, I'm getting really tired. That's because the brain has built up this adenosine, and then during that 4 hours, it gets cleaned out. And so now then you wake up for whatever reason. Some people wake up to they have to go pee, or some people just wake up because everybody does. But they can't get back to sleep because they're no longer tired because they don't have that, that tiredness, that adenosine making them tired. That's what caffeine blocks, by the way. It blocks that adenosine response. That's why so some people are really sensitive to that. So, what do? You just lay there for a little while because there's in between the deep sleep and the REM sleep is what's a light sleep. And you know what? It's okay if you're just laying there with your eyes closed, even for hours. It's okay. And if you look at a sleep study. the sleep pattern, it's normal to get 4 hours of light sleep. And if you were awake and aware and just lay there resting with your eyes closed and calmly resting, and not stressed out, that's the same essentially as light sleep. It's not the restorative sleep. It's just the in between sleep. And you could be awake and be in between, and that's okay. And you will actually have in between times you'll have REM sleep, and you won't remember the REM parts, but you'll remember being awake in between your REM sleep. So just so that you know that yes, after 4 hours you wake up and you go, I can't get back to sleep. That's okay. Just lay there and rest. Just say, I'm here resting. This is good.
All right, more questions. Bring them on. Bring them on in here, guys. This is good. I know we got a lot of questions. So Richard says, does coenzyme Q10 cause insomnia? I tried it once while on the statin and thought so, so I stopped.
Huh. CoQ10 itself doesn't cause insomnia, but if people are missing like CoQ10 and they're not making energy very well, and then they take CoQ10, it may increase their energy, and then so now their brain has energy that it didn't have before, and it like turns things on. So yeah, if I would suspect that if you took your CoQ10 in the morning, that it wouldn't have that effect. But it's not like caffeine. It doesn't block anything, prevent sleep or anything like that.
Okay. Anonymous said, I recently got a continuous glucose monitor and I find that my blood sugar jumps up in the middle of the night. Is this normal and what causes it? 4+ hours since food.
Yeah. So after 4 hours, you don't have any food left. So you're not absorbing any new glucose or fat or anything from your food. And so now your body has to switch to making your own glucose. And so the liver starts pumping out glucose and then it shoots up. And so that's not uncommon. It's pretty normal.
Okay. Um, excuse me. Okay, David said, I generally follow the intermittent fasting and the 6-10 schedule. How damaging is it to go out in the evening with a few drinks, snacks, etc., once a week or so?
Oh, good question. This is actually done. So Sachin Panda, Sachin Panda, I don't know how you pronounce it. Anyway, he's from India and he works in California and does research on this circadian rhythm. And so he was looking at that. What happens? I mean, you like everybody has to have a really strict circadian rhythm. You have to be in bed, at 10 o'clock every night and wake up at 6 every day, same time. And what it does is your body prepares for it before 10 o'clock comes around. By 9 o'clock, your body's starting to prepare for sleep. And then if you eat at the same time every day, your body will start preparing for it and to accept the food and to digest and detox and all of that stuff. Well, sleep is kind of the same thing. So having this very regular circadian rhythm is excellent. And then one of the graduate students said, "What happens if we give them the weekend off?" This is the rat studies they're doing, right? So what if they partied all night on the weekends and had pizza at 11 o'clock at night and didn't go to sleep? You know what? 5 days a week was adequate, was just as good for the rats, their longevity and all of that, as 7 days a week. So yeah, you know what? It's okay. It's okay
Yeah.
to be out sometimes and whatever.
Yeah. Awesome. Okay. All right. Next question. Christine says, does all of your sleep have to be at night? Can you have a nap after dinner and then sleep at night also?
Yes, you actually could. So the naps are generally not deep sleep. And the deep sleep ideally is between 10 p.m. and 2 a.m. So that 10 to 2 is kind of the important time. That's the restorative sleep. That's the anabolic metabolism. That's the good stuff. So you don't want to like wait till midnight to go to sleep. But if you took a little nap, yeah, ideally no, but naps. Uh, okay, here's the way to look at it. It's not. It's a total amount of sleep, like in 24 hours. You're going to get like some REM sleep and in your nap. And then you will have less sleep at night. So people who come in and tell me they can't sleep at night, and I ask if they take naps, and they say yes, and I say stop taking naps. Yeah, I had a guy who said he's awake at 2 o'clock in the morning, but he had to take a nap during the day. I said, well, stop taking a nap. Uh, and he's like, no, I want to keep napping. Well, then you're going to be awake at 2 o'clock in the morning. Well, what am I going to do at 2 o'clock in the morning? Well, I don't know, but you're napping in the afternoon. So if you nap, it may take away from the time that you're in bed sleeping at night.
Yeah. Okay. Suzanne says, I have to get up at least 5 times during the night to go to the bathroom. I feel like I have to really bad, but I only barely go. Why?
Okay, that is a learned response. So that can be changed. Um, and one way to deal with that, because your bladder's not filling up, it's just when you wake up, you go, oh, I better go. And like there's all kinds of things. People worry about peeing the bed and if their bladder's spasming, which is, the feeling of I need to go is actually a bladder spasm. The bladder's starting to contract down, and they're going, oh, it's going to come out. And some people leak, and that the fear of that is part of it. But if you want to just relax your bladder, then you take your mind off it and think of something else. You can also do deep breathing. Diaphragmatic breathing is the parasympathetic nervous system. So you're stimulating this parasympathetic, taking deep abdominal breaths, not letting your chest rise. And so you're in bed already. You just lay there and take a deep breath with your abdomen. So let your stomach go up and down and not your chest. And just do that a few times. It doesn't have to be, minutes or hours. Just a few times, and then go back to sleep. And so retrain your body when you wake up, because everybody wakes up 5 times, right? So you wake up 5 times, and every time you wake up, oh, bladder, gotta go, and your bladder's not full, and that's frustrating. So retraining that to when you wake up, no, I just lay here for a while and go back to sleep.
Yeah. Okay. Stefan said, is it normal to sleep longer and more when you get older?
Um, no, actually, the research shows you generally sleep less at night, and there's more awakenings and more difficulty sleeping, more difficulty getting to sleep as a rule, as a generalization, but yeah.
Anonymous said, I had tests done and they found that I have high cortisol late at night. Is there something that can reduce late night cortisol?
Oh, yeah. Yeah, that's important. Having a really good circadian rhythm, like doing the timing, uh, going to sleep at the same time, waking up at the same time, and not eating at night. Sometimes the cortisol goes up when, like 4 hours after eating and you're asleep, and the blood sugar drops low, then you release a bunch of cortisol. Um, and it used to be that, like nutritionists and neurologists, people would tell people who are waking up at night sweating and hypoglycemic attack, because they're releasing a bunch of cortisol and then they can't get back to sleep. So they tell them, have something by your bed that you can eat or whatever. But that's actually not a good idea. It's better to go to sleep with an empty stomach. You already have an empty stomach when you go to sleep. That way you don't have any food in your stomach while you're sleeping, so you don't release that cortisol.
Anonymous says, does length of sleep affect dawn phenomenon?
Oh yeah. Well, in a way, the dawn phenomenon is the cortisol release, and everybody releases it in the morning, and that's the normal pattern. That's what a normal circadian rhythm does. So if you're sleeping, 9 hours, is that different? You know what? I can't tell you. I don't know. As opposed to 7 hours, as opposed to 4 hours. But the reason I was going to say yes is because, yeah, if you're sleeping less, you actually have more cortisol release to try to wake you up because you haven't slept enough.
There was a question that came in that says, what is cortisol exactly?
Oh, cortisol is the hormone that regulates your circadian rhythm. It's the catabolic hormone that turns on in the morning and turns off at night. It's not even at night; it turns off like by 4 to 6 o'clock in the afternoon. Um, and so when people get a second wind, for example, and you go, yeah, I'm getting really tired, trying to stay awake, and then all of a sudden, boom, like, oh, now I woke up, I got a second wind. That's cortisol. You just released a whole bunch of cortisol to keep you going. So the cortisol is the wake up hormone in the morning. It's the catabolic hormone. It turns on your body, turns on everything, turns on your liver. It's the switch that turns on all the functions. And then so when it goes down at night, that's when you have to turn the lights off, and then your body can repair and everything at night.
All right. Allison said this hasn't anything to do with heart or diabetes, but my niece is 27 and pregnant, first pregnancy, and she had 5 months of morning sickness. Any idea how to fix it, shorten it, or prevent it? Please and thank you.
Okay, well, let's talk about why morning sickness happens. During pregnancy, the progesterone type hormones go up like dramatically, like they go from, let's say they're 5, 10 would be a number if you were to measure the level, and they go up into the hundreds to even the thousands. So you have this 100 times more of this progesterone hormone. And what does that do? Why does that happen? Well, it's a relaxing hormone. And so it allows the uterus to relax. So the uterus is this ball of muscle that's about as big as your fist, and it is tight. But progesterone allows it to relax, so the baby inside can grow and grow and grow and grow and grow, and it just allows it to blow up and get bigger and bigger. So instead of being a really hard small balloon, it gets to be a soft balloon that you can blow up. But other things happen, like your ligaments get lax, and so you get pains all over. You go, oh man, my pelvis hurts and my back hurts, and because the ligament laxity, the ligaments are allowed to stretch, but the pain from stretching doesn't change. You still have the same pain. Just because they're lax doesn't mean you don't get pain. So all of that part. So and then the other thing it does is relaxes the smooth muscle. The uterus is a smooth muscle, but so is the intestines. So the intestines are relaxing too. What does that mean? It means they don't function. They don't move things through quickly anymore. Things they're stagnant. And then so you eat something and it's still there tomorrow morning because it didn't. Because and so things don't move through, so it's easy to get like nauseated and to throw up. And then so what they often say is, when you first wake up, you have an empty stomach, kind of stimulate your digestion by eating something, crackers, something with salt in it, or something that's going to stimulate some movement. And if you get stimulating the movement, then the nausea decreases. Um, there's no easy way around this. It's like my wife tried so many things. She had those C-bands that have a little dot on them that put pressure right in between those two tendons. And they're called CSEA bands because they're for nausea, for seasickness. And it actually worked. It's a pressure point, acupressure point for relieving nausea, and the band keeps pressure on there all the time, so the nausea goes away. And so she was using the C-band. She was taking not medication, but natural things to try and calm the nausea. And it didn't really work. She was kind of all the day before she delivered one of our children, she threw up in my car and made a big mess. So, I don't know. I don't know that there's a good way to do it. And she's a pediatrician, by the way. So I don't know that there's a good way to do it. So
Yeah, that's tough.
yeah.
Okay. Lily had said, Dr. Saunders, your suggestion to take MSM for my aorta alleviated my pain. I'm so grateful to you and for that, and also for your vast knowledge of the body and your generosity to share that knowledge. My cardiologist didn't have a clue about any of that. Thank you, thank you, thank you.
Oh, wow. Cool. It worked. See, I don't get a lot of feedback. I don't know that if things work all the time. So that's cool. Thank you.
Yes. Mary said there are magnesium gels advertised to help you fall asleep because they relax you if you rub a small amount in the bottom of your feet. Do you know if they're effective?
They can be effective. Yeah. Magnesium is actually a muscle relaxant. In fact, it's the only muscle relaxant that actually works on the muscles. Every other muscle relaxant, except for physostigmine, but we're not going to talk about those. So all the things that they sell as muscle relaxants actually work in the brain and just make you drowsy. So you go, okay. So it relaxes you by making you dumb. Whereas magnesium actually relaxes the muscles. And so, yeah, it can work. And I don't know about the gel rubbing it on the bottom of your feet. We have a spray that you can spray on your feet and all over. And I know Leslie uses that to go to
Hmm.
bed at night.
Yeah. I really fall asleep fast and easy. So I hate saying that out loud because I don't want to jinx it at all. But I do use magnesium and that does seem to help. And honestly, I think too, if you're a female, maybe get your hormones checked. I think that makes a big difference also.
Yeah.
So something to consider. Okay. Denise says still experiencing frequent urination every 2 hours at night, even though I've been taking the supplement since May. Hopefully that urination issue will go away soon. Also, no caffeine and no alcohol in my life. Normally go to sleep around 9:30 or 10 and wake up around 6 a.m.
Perfect. Okay, so then the question that you need to ask is why? Why? So one of the things that you would start off doing is actually measuring. So you pee into a cup, a little measuring cup, and measure how much urine is in there. If it's more than 1 cup of urine each time you pee, then that's kind of normal. So your bladder can hold between 1 and 2 cups, between 8 and 16 ounces would be a full bladder. So if you're urinating and you're only getting a quarter of a cup or a half a cup, then you go, I could have lasted another 5 hours or whatever for that. So if every time, if you're peeing 5 times and you're getting like 1 to 2 cups every time, then you've got an ADH problem, and you need your pituitary checked, and you need some other tests done to find out why that's happening.
Hmm.
So don't just say, I hope this goes away. And that's the thing, I hope this gets better. The best way to look at this is, what I'm currently doing is not working. I tried all of the things you said and they're not working. So what's the next step? So the next step for you is to find out why. Is this a hormone imbalance? Is this a bladder problem? So one of the things that I do for people that have that frequent urination is a bladder ultrasound, and with a specific thing called a post-void residual. And that ultrasound with the post-void residual tells you, bladder capacity with post-void residual. So it tells you how big your bladder can get. And then after you urinate, is it all gone? Because if you got your, if they tell you, yeah, 250 cc's, that's about 1 cup of urine. Is that right? No, 250 cc's is about 2 cups, right? So if that, so 125, 250. So if they say you have 250 cc's, and then after you go and pee, you still have 200 cc's, then there's something wrong with your bladder. Okay, then that's a different issue entirely. There might be an outlet obstruction, or there's something anatomically wrong or functionally wrong. So figure out what the problem is, and then you can work on the problem. But just saying, I hope it goes away someday, doesn't always work.
All right. Joby said, will niacin help with diabetes?
Oh, you know what? Niacin helps with energy. And gosh, I did this whole research thing. We did a Home Cures That Work. So go to Home Cures That Work and look up the article on niacin, because it helps with energy, but it's not going to take the place of doing a like phase one of the program. So, you still need to be insulin sensitive, and niacin is not going to make you insulin sensitive. But if you're deficient in niacin, you have low niacin, comparing a 30-year-old to a 60-year-old, a 60-year-old is going to have half as much niacin in the body as a 30-year-old, and it's actually nicotinic acid, more anyway. So that limits energy production in older people. So yeah, you may need niacin anyway.
All right. Mary said, my 27-year-old son has a work schedule that allows him to choose his own hours. He prefers to stay up until 2 or 3 in the morning. However, he does usually get 7 to 8 hours. Would he still be getting the 4 hours of deep sleep even though he misses that 10 to 2 a.m. window?
As a rule, yes. And that's the funny thing about it, that the research done on circadian rhythm by Sachin Panda. You can read a book about that. It's called The Circadian Code, by Sachin Panda. And he talks about how important it is to have that 10 to 2. So people who, decide they want to be out all day, and then they can do their work, from, 6 p.m. to 2 a.m. or whatever, because you do online work and you can do it any time of day, right? So that kind of thing actually probably causes you to miss your restorative sleep.
Okay.
You know
Denise says,
what? That's another
oh,
one. If you get a sleep monitor, then you can find out specifically for you. Some people are night owls, some people are morning larks, and the night owls can get away with going to bed later, and so maybe.
okay, Denise said, hubby falls asleep during the day, but sleeps a regular schedule at night. Meds include low dose aspirin, thyroid meds, prostate meds. Are the meds responsible for his fatigue syndrome? And he does not realize he's fallen asleep. It's
Oh, that's
the reason he doesn't drive anymore, and he's 81 years young.
yes. It's a problem. I find that very commonly. I had someone in my office yesterday. She has diabetes, and she has some adrenal issues. And so she was put in on a whole bunch of medications, because the adrenal issues makes her blood sugar go up, makes her blood pressure go up, makes her gain weight and all this stuff. So she was on all these medications, like, one medication wasn't enough for blood pressure. So then she gets two, and then she gets three, and then she gets the diabetes medications, and they're not working because they're not going to work because she has high cortisol levels. So we have to deal with that first. But all these different doctors in the meantime are saying, well, take this and take this and take this. And so she's got an armful of medications. And I said, well, that's not going to work for you because your problem is this adrenal gland. Unless you address the problem, all these other medications aren't going to be useful. So she got off them, and she came back to me yesterday, and she's like, you know what? I feel a lot better getting off those medications. just that.
Okay, Sid said I started taking magnesium glycinate, 240 milligrams, 2 weeks ago. Take it about an hour before going to bed. I must say I've been sleeping longer intervals during the night. Is nighttime really the best time to take it, or does it not matter?
Well, it doesn't matter as a supplement, but for sleep, it will probably be better for you if you take it at night because of the muscle relaxant effect.
All right. Suzanne says or does plantar fasciitis, and now my toes hurt and feel like my toes are actually twisting. Why?
Um, because um, the fascia is like a ligament, but it's kind of like a big flat ligament that goes from your heel and then attaches to all the different metatarsals. And it's if it with the inflammation in there, you get scarring, and the scar tissue can pull on your toes in different ways, causing them to feel like they're different, and they're not like relaxing out normally. So yeah, plantar fasciitis, you really need to deal with that. And when you go to physical therapy, they give you, I don't know, we were given like a tennis ball to roll around on the bottom of your feet, to massage the bottom of your feet. And that's all okay, but that doesn't address the cause of it, why it's there. And then some of the podiatrists that treat it will use an injection of cortisone, of whatever kind of cortisone. And they don't do that as much anymore because the cortisone is a catabolic hormone, meaning it breaks down the tissue. So it causes softening of the ligament, which can make it feel better in the short run, but in the long run, could cause fallen arches and other problems.
When I did Whole30, mine went away. Just, I mean, I only had it once, and just from not eating any inflammatory foods, I think it made mine go away. It's actually never come back, which is interesting.
Wow, yeah, Whole30. So anti-inflammatory diet. Yeah, I didn't mention the other things like changing your shoes or getting shoe inserts,
Mm,
grounding, going barefoot outside
yeah.
periodically. Yeah, those are other ways to deal with plantar fasciitis.
Denise said hysterectomy at age 34, and I'm 73. Bladder has dropped.
Yeah. Okay. So there's a surgery that they do, bladder neck suspension. They're really, this is an anatomical problem. You know, the anatomy allows the bladder to drop, and so you have a bladder with the urethra, and then when the bladder drops, it kind of kinks the urethra, and so it makes it uh, sometimes difficult to urinate, or you can't empty your bladder all the way. You can get urinary tract infections frequently. So to deal with those problems, sometimes you need a surgical bladder suspension. Now, just after having said that, I know sometimes they work, but when they don't work, they're so bad. I've just had several cases of women who've had the mesh bladder suspension, and then the mesh eats into the wall of the bladder over time, and you can't tease it out. You can't get rid of it at all. You can't pull it off. It's a disaster. So yeah, just avoid that kind of stuff. Be careful what kind of surgery you have.
Someone here says, I have wild feet at night, so would rubbing magnesium on the bottom of my feet help? I spray the magnesium on my feet, but that doesn't help much.
Oh, yeah. Rubbing it, gel. You can get, let's see, I think it's Epsom salts are magnesium sulfate, and people soak their feet at night in Epsom salts. That wouldn't be a bad way to do it either.
Trying to think, like, is it restless legs?
Yeah, or
And
LS.
so maybe figuring out why you have that too.
Yeah, yeah, that would be the first order of business. I agree. Find out why you have that.
Yeah. Okay. Our time is up for today. Dr. Saunders, thank you so much. Hope you all sleep well
Welcome.
tonight, including you, Dr. Saunders. We'll see you next week. And those of you who want to go back and rewatch this, remember that we are live on YouTube as well. So I posted that link in the chat, but we'll be here next week, same time, same place.